Well, hello, everybody. Thanks for joining the webinar tonight. For those of you that I haven't met, my name is Stephen Moore, and I have been hosting webinars like this now for nearly 15 years as I've had a huge passion in the importance of nutrition and healthcare. And this is a project that I've been working on for quite some time, and I've been able to and privileged to speak about this all over the US and South America as well. And tonight, I'm very pleased to have a friend of mine, Dr. Benjamin Gonzalez, as our keynote speaker here tonight. For those of you that don't know Dr. Gonzalez, he's a medical director to Atlantis Medical Wellness Center in Washington, D.C., Maryland. And a little bit about him. So I know many of you have been attending some of the anti-aging conferences, AMMG and A4M. Dr. Gonzalez has been the keynote speaker at both of those conferences multiple times. I think you did a breakout session, Ben, for 6 hours at one of the A4M ones, and you're just very much appreciated by both of those groups. And it's really nice to have you on the call here tonight. And so maybe if you could share with anybody a little bit about you, because you're not just your typical doctor, here. You're certainly not an average doctor. You are a super achiever. And I think as physicians are looking for ways to help their patients, it's so easy to get caught up in the marketing efforts of a lot of the different companies. It's very time consuming. You go to conferences and you're overwhelmed with the number of booths and companies trying to install things into practices. And you're really somebody that people look up to. You do consulting, you do coaching. And I think that you're a great person for a lot of physicians to learn from, because you certainly know your stuff and you do your due diligence, not only in hormones, in weight management and metabolic testing and nutrition and genetics. You're very well-rounded and well-versed in all of these subjects and can teach huge lectures on all of them. So I think one of the things that I really find impressive, and I remember it was maybe 15, 20 years ago. And I remember seeing this medical doctor from Harvard University on some of the health shows about how medical doctors need to shift more to functional medicine, more on nutrition, diet, and lifestyle. And I remember reading some of Dr. Andrew Weil's books. For those of you that don't know Andrew Weil, I'm sure you recognize his face. He's one of the gurus out there, and has the big white bushy beard and bald head, and he's written a lot of books of wellness, and he's been a pioneer really in this field. And when he had started the integrative, I don't know the exact name, integrative and wellness program at the University of Arizona, you were one of the first 4 original people to be physicians to be mentored by him in his first class, right?
Yeah. So with Dr. Weil, we were talking about, everybody's been talking about integrative medicine, functional medicine, if it's a new thing over the past 10 years, past 5 years. And this is kind of sad, 30 years ago, Dr. Andrew Weil was talking, and all of us were talking about bringing nutrition into medicine and being an integrative part of medicine, talking about integrative medicine, functional medicine, and talking about the obesity crisis and our overweight problems. But this was like 25, 30 years ago. What's really sad is that we have that same narrative now, exact same narrative, with not much moving forward other than a lot of more talk about it. And that's been sad. But yes, I was at the University of Arizona with Dr. Andy Weil. He was one of my mentors there 30 years ago, something like that.
Yeah, so tell us a little bit about your background and kind of some of the things that you've studied, and a little bit about your practice, if you don't mind.
Well, basically what Steve was saying about all this stuff that I've done in the past, basically the bottom line is I can't make up my mind. I go to one thing and I really liked what I find in one thing, and then I see some mistakes and I try to improve on those things for myself, education-wise and knowledge-wise, and then I move on to the next and the next and the next. That's basically been my career for the last 30 years. I started out actually not as a physician. I flew in the Air Force. I was interested in sports medicine and nutrition, and because of my background in sports and sports medicine itself, I really got into nutrition before medicine. I did my undergrad and master's work in genetics and in nutrition. Went to University of Arizona College of Medicine, and after where I met Dr. Andy Weil. Again, before Dr. Weil, though, I was really into nutrition and sports medicine. But it was Dr. Weil there, along with a lot of other good doctors and mentors at the University of Arizona, that really got me to understand that nutrition and medicine are one and the same. And but because of my my interest in multiple different things, and I really I fell in love with emergency medicine. I did emergency medicine trauma for about nearly 15, 16, 17 years. I did that in the military. I was in the military for 24 years active duty. I studied it, like I said, at University of Arizona, but then I became a professor at Walter Reed Army Medical Center, where I was, and I taught and did research at NIH. I taught at Penn State Hershey Medical Center. Bottom line is, all my background, everything, no matter what it was I did or what it was I studied, nutrition was the fundamental part of that, whether it was emergency medicine, whether it was trauma, or whether it was hormones, or whether it was toxicology, didn't matter. Nutrition was the base for everything. And I recognized that. After I retired from emergency medicine from the military, I founded my center, Atlantis Medical Wellness Center, where I practiced integrative and functional medicine. That includes everything from hormone replacement therapy, nutrition, metabolism management, and all of that. And we all know, in the assumptions for interest at time, because we could go on and on and on about nutrition, right? We know that poor nutrition leads to disease, that your patients listen to Oprah, right? They listen to Dr. Oz, they listen to Marie Osmond. I mean, we get our weight loss advice from, Dan Marino, people like that. But indirectly, so do physicians. Physicians listen to these sources, and it dilutes our knowledge. It dilutes our expertise as physicians. And in general, physicians are nutrition ignorant. Physicians have little time to discuss nutrition. I mean, when was the last time, if you have a busy practice, internal medicine or OBGYN practice, when was the last time you talked about nutrition with your patients in depth, or had the time to do that? We really have little time to discuss nutrition and supplementation properly, and you're looking for expert advice. And one of the things that brought me into Pharmanex and the scanner itself was the fact that the scanner program can bring in the discussion of nutrition into your practice very readily and very, very easily. Because what do we depend on as physicians? We depend on objective information and our ability as physicians to take that knowledge and that information and apply it clinically. There's a lot of studies out there, a lot of different studies that we depend on. And I think Steve has prompted me to talk about my patients here that bring in their supplements. But we have a lot of different studies that discussing nutrition, but studies are very difficult interpreting for nutrition and supplementation. And patients do this to you. I know they do this to me, because here's a picture of one single patient's, and the next 3 slides, by the way, go ahead. This is the first slide, the next slide, and the next slide. This is one patient's bag of supplements that they brought to me because they heard that such and such a supplement was good for this and such and such supplement was good for that. And just because something's good for you doesn't mean that that you need it, number one. Number two, what is this patient basing their information on? All these other experts and pseudo-experts out there telling you that you need this and you need that. Well, we need objective information. And the scanner provides that. The Pharmanex scanner provides that objective information. Steve's going to go into a little bit about, not right now, but he's going to go into a little bit about the scanner program itself. But I want to tell you this. Prior to the scanner program, in my practice, I was the expert. I was the single source of information and the beginning of the discussion for nutrition information in my clinic. And again, time. It takes a lot of time to do that. Well, how do you bring the discussion to nutrition? The scanner can give an objective single bit of information, and I'm assuming that everyone that's on this discussion here saw the scanner at AMMG. Is that true, Steve?
Well, some of the attendees here do, but we've opened it up to some other people that have been wanting to hear from you. So there probably are some people on here that don't even know what the scanner is, but we're going to assume most of them and do. For those of you that don't, what Ben is referring to is the biophotonic scanner, which is the world's first non-invasive way of measuring antioxidants. And what it really provides is an objective and practical approach to incorporate nutrition and wellness into a medical setting. Because what Ben was saying is, yeah, the doctors are busy. We've got all this information out there, but we've got 10, 15, 20 minutes or sometimes even less than that with patients. How do we consult that patient, and how do we incorporate this in a practical way that's going to work, safe, and be effective? And Ben, I think you're also going to go over, why you even do it in the first place, why even bother, right?
The scanner can give me an objective number that can give me the general antioxidant status of an individual. So if I'm going to operate on somebody and I look at their basic labs, and we get their basic labs, your liver function's good, you're looking at kidney function, liver function, hemoglobin, hematocrit status, maybe some other things. But what are the things that primarily help someone heal in general, whether I'm doing surgery or whether someone has an injury or just going through their daily stressors? Well, antioxidants, right? The antioxidants are the tools in your body to help fight off aging and disease and help with healing. Well, I can get an objective number within less than 60 seconds, get an objective number, and I get a better an idea of an antioxidant status of my surgery patients, for example, or my patients in general, whether they're weight loss patients, surgery patients. I utilize this score as a vital sign. So when a patient walks through the door in my clinic, they get their basic vital signs that include both, of course, obviously the blood pressure, the weight, body fat percentage, heart rate, things like that, but then, and also the biometric marker of the antioxidant status, because it immediately gives me a number to talk with the patient about in describing their general nutrition status. Now, it's not a specific diagnostic tool, and I want to make that really clear. I'm not diagnosing someone's individual issue, but I'm giving a general antioxidant status that I can discuss their from which I can discuss and bring in the discussion of nutrition. And it can be very, very powerful, because I get these athletes. I have a lot of athletes that come in. It's a good example. They come in and think, I eat really well, and I'm healthy, and I exercise quite a bit, and I'm in great shape. And then I get their antioxidant status, and surprisingly, most of them are very low. Why would that be? Well, because their oxidative stress is high. They're doing a lot of exercise. They may not be eating properly or absorbing the proper nutrition in their body to help bring up their antioxidant status. So then it gives me, again, a discussion, an objective number for discussion on doing that. And it allows us to improve that number, right? So the initial advice, of course, is to eat right, more fruits and vegetables, and then to supplement properly. How do you know to supplement properly? Steve's going to go into a little bit about Pharmanex and the supplements themselves and how they're developed at Nu Skin and Pharmanex. But the bottom line is, I trust these supplements enough that I require every single one of my surgical patients, I require them to begin these supplements before a surgery and for 3 months after the surgery to help for improved healing. And there's a significant difference in those who do and those who don't. In fact, to the point where now I require, like I said earlier, I require everyone to do that. Before it was optional, and then I see the difference, and now I require it. And that's been over the last 10 years. 8 years. So if we can move on to the next slide, let's get away from this slide. So we have these oxidative stresses, and the patient is exposed to all this junk out there, right? And we already know, I'm not going to go into this country's obesity issues. We're not going to go into this country's overall issues with increased diabetes. The younger patients coming in, younger to my clinic with type 2 diabetes. I have a brother-in-law who's a pediatric endocrinologist whose practice started out about 25, 30 years ago, same time mine did. And at that time, less than 3% of his pediatric patient population was type 2 diabetes, less than 3%. And just fast forward, and now he has the entire separate clinic, and over 30% of his patient population deals with type 2 diabetes in his pediatric endocrinology service. And that's pretty sad. And why is that? Is it because our genes have mutated to the point where we have obesity and we have diabetes issues? No, it's because of what we're exposed to. And this picture is illustrating what your patients are exposed to. You can move on to the next slide, I think.
And I think that just to kind of reiterate that, I mean, many of you have often heard me say that I'm a big believer in whatever you focus on expands. And the marketing efforts of these companies are trying to get your patients to focus on making poor food choices. And the scanner switches that, to the point where I've got little kids, and since they were 2 years old, they focus on getting their score up. And my kids, when they were 2, understood fruits and vegetables, what colors they are, where they come from, and how they can boost their score and how they can win. And it's fun. It gamifies it for people. And it helps people focus on the right behaviors, the right activities. And then we know people aren't going to be perfect every single day. And that's where getting them on the right supplements that we can measure and show them results and give them feedback to keep them compliant and keep them on this path or this journey of minor corrections compounded over time is what's going to lead them to a healthier lifestyle. And the scanner really gives them that consistent monitoring and validation that the changes that they're making are doing something. Because I believe that if people ate a cheeseburger today and they had chest pain immediately, they probably wouldn't go McDonald's again that week. But because the effects of eating poorly, we don't feel the problems until decades later, it really allows people to keep making those poor choices because they can't feel or see the impact that it's making on them. And this scanner technology allows people to see in a matter of weeks or to a matter of months that those changes in behavior are either positively or negatively impacting a number, which is very personal and emotional to them.
To give you an example, if you have a patient who's feeling well otherwise, and you get the basic labs, and you find a couple of surprises. Your cholesterol is 324, Mrs. Jones. Your blood sugar is 130, even though you feel well, your blood sugar is 130, hemoglobin A1C is 6.8, but you feel well. What does that do to your patient's focus? It allows them to focus on, and allows it gives them an objective number to think about. That's the same with a score. Someone can feel really well on it, but if their score is really low, all of a sudden it gives them something to think about. Like, why is my score low? Now they're thinking objectively, why is my score low? What do I need to do about it? And even, I have vegetarians who score low, and I have patients who eat poorly that score really high. And then you have to clinically correlate that, of course. But it gives them a number to focus on. And so now you have something to follow and track. And like I said, I use it as a vital sign in my clinic. Go ahead and move on to the next slide, because I think here's where, yeah, exactly. So if a patient gets an objective number or some information, actually move backwards one, where are they getting their advice? The patient today came to me, and this is like my 3rd visit with this patient, came to me, and she had heard from one of my staff on the 1st visit, just in passing, one of my medical staff had told the patient, we noticed that your magnesium, your red blood cell magnesium, is pretty darn low. I know Dr. Gonzalez will want you to start taking magnesium. He'll give you some advice on this on your next appointment. Well, what happened today is the patient had said, oh yeah, your staff had mentioned that my magnesium was low, and I knew my antioxidants were low. So I went out and I bought, and then she told me what she bought. She purchased a bunch of magnesium, a bunch of vitamins. And I said, that's great, but how did you source this? Where'd you get this information? Oh, well, I Googled and I heard that this celebrity liked this vitamin, and I got this information to order from Amazon. And so they were getting all of this mixed information from all these different pseudo experts, and there she brought her bag of 3 or 4 different vitamins that she purchased. She just wanted to show me she was already ahead of the game, taking vitamins to help improve her overall health. When in fact, most of the stuff that she had really wasn't any good at all. Wasn't going to do her any good. So your patients are looking for information. They're bringing their bags of goodies, thinking that they're improving themselves. They're getting their information from all these people that sound smart, these professional bloggers, these internet celebrities, these journalists, nutrition and metabolism specialists, right? And they all sound smart because they get their information from PubMed and they know the scientific jargon, but they have this abstract knowledge and they don't have clinical experience and application to get that information correctly. And then, of course, what else don't they have? They don't have the right sourcing of proper supplementation, or even how to supplement correctly. So you need to be that source. Exactly. Actually, this is a quick discussion on the business slide. Let me jump to that in a moment. But you need to be that right source. The scanner allows you to get an objective number to provide, first of all, the information that someone needs to improve, number one, an objective number. Then number two, PharmaNex provides those sources of high quality, and again, Steve's going to get into quality improvement, and but high quality supplementation that allows for a patient to have an actual rise in their antioxidant numbers and in their improved health. Now, I want to spend just a few moments here, Steve. I know the time is running down a little bit, but I want to spend a few moments in some of these supplements and why I recommend them. Like I said earlier, I require my surgical patients and some of my metabolic patients to take certain supplements from PharmaNex for two reasons. One, I know the quality, obviously, and then I know it's going to work. But most patients ask, well, I have this other supplement that has the exact same thing in it, or they think they have the exact same thing in it. And the problem with that is that patient doesn't understand that it's that the quality maybe is the sourcing and the quality of that supplement has not been vetted and adequately developed as it has in the PharmaNex and Nu Skin R&D. And you can find these supplements in the physician's desk reference, the ones that I recommend to my patients. And that's powerfully important as well. Because to get into the physician's desk reference, these supplements have to go through a vetting process and things like, for example, what's the popular multivitamin out there? Not one a day, but Centrum. Centrum being found in there because why? Because we know that Centrum really is not a quality product and doesn't have a great bioavailability. Sorry about that. Bioavailability that allows for an increased improvement in antioxidant score. So I just want to mention that real quick because that could be a long discussion. Now,
and after Ben kind of shares a little bit about his experience, I'm going to go through a little bit more about the scanner, the business model, how this is really a really paradigm shift in the way that we can take care of patients with nutritional intervention. And, we have some physicians that have added over $1 million of profit to their practice, all cash. And I know many of you are probably sending that money out the door. You're trying to figure out a way to help your patients. And, if you're doing what I was doing when I came out of school and opening up accounts with all these different vitamin brands, it really does seem like the more research I was doing on different brands, the more confused I became. And it takes more than a doctor to figure it out, or a few doctors to figure it out. It really takes a army or a whole team of scientists working together. And that was what really impressed me about PharmaNex, is they were led by 3 of the top drug discovery scientists that were experts at natural medicine for drug discovery. And now they employ 100 full-time scientists. Nearly half of them are PhDs, all working together. So PharmaNex has put together one of the largest, or actually by far the largest research and development engine. And now this scanner is such a powerful tool to test patients, much like we test them for any other vital sign, right? We don't know where that patient is or how our treatment is working if we don't have a convenient way of testing.
And this slide is to remind me of this doctor that I spoke with about a year ago, an ophthalmologist, and we were talking in passing at a conference. And I asked him, I said, look, I did a lot of this antioxidant research out of NIH. It was mostly in wound care, trauma care, antioxidant research, but most of the research for antioxidants came out of your specialty, ophthalmology specialty. And he said, yeah, I'm very aware of that. And we were talking about treatments for different disease processes. And then I asked him the question, I said, so what supplements do you recommend to your patients, especially those with macular degeneration, where we know that antioxidants is the treatment for macular degeneration? And he goes, "Oh yeah, I have there's and he gave me a brand that he prescribes to patients. And then he said, I said, well, what about if you want to go further than just that one particular thing? He goes, oh, I just sent him to GNC. It was difficult not to hug the poor guy because I really felt sorry, not for just the doctor and his patients, but that I understood that he just illustrated how most of us doctors treat micronutrient replacement, even just not observing, but measuring micronutrients and just giving the basic information and telling patients that, one, the first mistake we make is we say you can get all your vitamins from just eating right. That's our first mistake that we make. And then the second mistake we make is we send them off to GNC or to some other, or to Amazon, worse, to Amazon, to get their supplementation. And, we have a lot of pressures as physicians, a lot of pressures that distract us from doing the right thing, truly distract us from doing the right thing. And we don't have a lot of time to get the right, to get the proper advice. And we can't put ourselves through a nutrition fellowship. We don't have the time to go through what it really takes to get all this knowledge. But what the scanner does, what the Pharmanex program does, is it allows a lot of good information to get to you quickly and allows you to utilize that good information to give good advice to your patients. It doesn't matter what specialty you have. And that's just what I wanted to remind